Kingston Health Sciences Centre is a critical part of our local healthcare system. Having state-of-the-art equipment and facilities here means better quality care for our family, friends, and fellow citizens. However, much of the current building facilities are now outdated, too small, and in need of renewal. So to address current and future needs, the provincial government has agreed to fund a major redevelopment of the hospital, a project that could cost as much as $1 billion. But a condition of the funding is that 10% share of the money has to be raised locally before the province will then fund the remaining 90% of the project. Because the overall hospital redevelopment is such a big project, that 10% share means a lot of local money needs to be raised. The Hospital Foundation, which is in charge of local fundraising, has approached the city and asked for a contribution of $25 million towards that local share. Now, this amount is far beyond what the city can accommodate within our existing capital budget, and that means it would need to be funded with a dedicated property tax rate increase. Over the next 10 years, the city could fit about $10 million into our existing budget and would then need to impose a 0.6% property tax increase to raise the remaining $15 million. Now, we'll be discussing this request at our City Council meeting next week, but in advance, I'd really like to know what you think. The hospital redevelopment is critical for our community's future, but I also know that residents are grappling with a rising cost of living and other financial pressures. Now, you can write to me with your thoughts on this at mayor@cityofkingston.ca. I also encourage you to reach out to your city council. The more input that we receive from the community, the better position we'll be when we discuss this request at our City Council meeting next week.